My name is Behn Banihashemi. I'm a cardiologist, partner at Maryville Cardiovascular Consultant, founder and CEO of Cardiac Longevity Clinic. And I have one of my good friends and colleagues today, Debra Sloan, dietitian. I'll have her introduce herself. And we're going to chat today a little bit about metabolic syndrome, diabetes, diet, and cardiovascular disease, and everything exciting about nutrition. Deb, please. Who are you?
Hey, Ben. Ooh, why? So much to say. I'm Deb. I own my own dietitian company called Debra Sloan Healthy Solutions. I've been doing that for over 10 years now, since I moved to Ottawa. And I am so excited to be working with Ben now. This is a new partnership, working with the Longevity Clinic. And I see a lot of patients ranging from kids and youth athletes to celiac patients to people with type 1 diabetes to a lot of menopause, people dealing with perimenopause and menopause these days. And you kind of name it, lots of different stuff related to sport nutrition and performance. And now obviously with the cardiometabolic health is coming in with lots of patients seeing that. So this is great. Lots to talk about today.
Yeah, lots to talk about. So I think we're going to start with just kind of this idea of metabolic health, right? Like metabolic health and like what is metabolic health? I mean, I had a recent conversation about this. I mean, a lot of people don't really understand well what that means, right? Like for a lot of people, that's not really a tangible thing. Like, what does that mean? So I think you are actually a very good person to talk about that because I think essentially metabolic health is about energy input and energy output, right? So do you want to talk a little bit about that? Like, what does that mean to be metabolically healthy in your, experience and expertise?
I think overall metabolic health means that your energy systems, your muscles, your heart are working well for you. Efficiently for you. So burning the energy that it's supposed to burn, using carbs, using fat, which is influenced by both exercise and what we put in our body and to some degree genetics as well. So I think that would be the full picture, which I think, when I'm talking to patients about metabolic health, maybe as a dietitian, I have maybe a strong bias towards the exercise piece. I mean, I think personally and professionally that speaks to me, but I think that that's a really powerful piece of the puzzle outside of just diet alone in terms of being able to manipulate and control your own metabolic health. I don't know if does that answer that question?
Yeah, no, I think it does, right? I mean, the way I discuss it with patients, I usually tell them, like it's basically how your body takes in that energy and turns whatever you eat into the units of energy in your body, which is essentially ATP. So I get a little bit more scientific on them.
Yeah, you go for that part.
But yeah, I mean, you're right? And then the other thing that you hear a lot about these days, I'm sure a lot of our audience have heard, is this idea of mitochondria, right? So a lot of that metabolic health comes to about how your mitochondria is working. These power plants inside your cell, which produces ATP, which is the unit energy block of your body. Mm-hmm. So how does that energy come in? How does it go all the way to the level of your mitochondria, the engines of the cell, and how does that turn into ATP, which is the unit energy that all of your organs and tissue can use? And the more efficiently you do that, the more metabolically healthy you are. Is that a reasonable description?
Yeah, I mean, that's totally reasonable. I mean, I think we hear about metabolic health when we talk about the cardiometabolic health. I think it often comes out with people who have prediabetes or type 2 diabetes. It's not exclusively that, obviously, but I think that's where the term somebody gets diagnosed with prediabetes and the doctor says you have metabolic syndrome and they're kind of like, well, what does that mean? You know what I mean? This full picture of often those, the blood pressure, the cholesterol, the triglycerides, all of those things coming together in sort of all of those risk factors, but they're all related. So I think that's where the diet and exercise piece is really important because you can manipulate all those things. And I guess we'll come a little bit early on the topic of my personal experience with type 1 when we talk about like the mitochondria, because for better or for worse, I have a glucose sensor that I wear all the time that gives me constant feedback on what's going on to some degree with my mitochondria and how I'm actually able to change that in an adaptive way by the type and duration and intensity of the exercise that I do, where I've seen my glucose levels actually change in response to training, running longer and slower, and training that aerobic base, where then my glucose levels don't, drop into hypoglycemia really quickly. So it's really cool to be able to see that actually happen in real time, where you can actually train those powerhouses to, use different energy in different ways. Not everybody's wearing a glucose sensor, but I mean, it's happening, even for somebody who has type 1 diabetes, right?
Yeah, so that's very good. I'm glad you actually talked about that, right? Because we talk about this metabolic health. A lot of it is this idea of, I think it's called metabolic flexibility, essentially, right?
Metabolic flexibility for sure.
Right? Like what source of energy is your mitochondria able to use in order to make ATP, right? Like, is it only using glucose, or is it able to, for example, access the fat, your adipose tissue? Right? So that's what you're kind of referring to essentially, is because you're so metabolically fit, despite the fact that you have diabetes, your body is able to actually utilize your fat. And because of that, your glucose levels remain a lot more stable?
Well, I mean, the fact that I have type 1 diabetes is sort of relevant and not relevant in the sense that it's, I'm manipulating what I'm doing with insulin, which is, not from an external perspective. But what I found really interesting was my ability to change my training, which changed the way I was utilizing glucose or fat and the proportion of which I was doing so. So what it means is, okay, you could call me an athlete and, put me in a particular category of people, which is maybe not the average person, but regardless, it's just an example of what the average person actually is able to do with exercise of any kind, right? And to some degree, dietary changes, fasting protocols, changing the ratios of glucose that they're giving themselves and the fat that they're giving themselves. And we do this with athletes sometimes, right? When they're training for distance or ultra marathons and things like that, where they train low on low carb and they can train their fat cells to use fat better. Or they train on more glucose to get that, intensity and that performance out. And they, then they become maybe more reliant on glucose. So I think it's interesting to look at certain individuals maybe that aren't the average person and then extrapolate that information to say that this is actually something that everybody can do to improve their metabolic flexibility, improve their ability to use fat for energy, improve their ability to use glucose for energy. And as we age and our muscles start to shrink and all of these things, we start to see cardiometabolic health declining or those metabolic risk factors increasing, that some of those external things that we can do with diet and exercise actually do make a really, really big difference.
Yeah. Well, I think, is a very good description. So now let's go to the other end of the spectrum, right? Because people ask me about this all the time. It's like, why should I care? Why should I care that I'm metabolically healthy or not? Why does that matter? You kind of pointed that out a little bit, right? This spectrum is you kind of start from maybe not being super metabolically healthy, and then you slowly kind of move into insulin resistance that we're going to talk about a little bit, and then pre-diabetes and eventually diabetes. So what is the price that people are paying for not being metabolically healthy? Let's talk a little bit about that.
Oh, well, I think it has a trickle down effect to literally everything on a day-to-day basis, from chronic pain, to inflammation in the body, to getting a good sleep, to energy levels, throughout the day, how their, if their insulin is fluctuating and their glucose levels are fluctuating throughout the day, they're finding that their mood is not always stable. Obviously they should care because they're at higher risk of early death, but, to put it bluntly, but I think on a day-to-day basis, when people, tune into their diet a little bit and can get their glucose levels under better, stability and better control, and they start increasing their fitness level, energy, mood, sleep, mental health, all of these things, gut regulation to some degree, even it's all kind of correlated. So I guess that's, I think, what's so great about the clinic too, just to plug that a little bit, is that we've got the sleep, and then you've got the psychologist, and you've got the nutrition piece, and you've got all of those pieces of the puzzle where people actually can dial in on all of those things and see, because they are correlated, right? If your sleep is shit, well, you're going to have a harder time managing your glucose levels. If your stress levels are high, I mean, it's all, bad. If you don't have energy to exercise, it's hard to ask someone to exercise and cook more. And, so I find that it's that circular piece, and has to be kind of comprehensive. Can't look at each of those things in a vacuum, I guess.
Yeah, no, I agree with you, right? I mean, that's why we do it this way in the clinic, right? Like with you kind of managing the diet piece, but also we definitely have that sleep optimization piece, the exercise piece, the mental health piece, because they're all very much connected. Like if you're not sleeping well, you won't be able to have proper nutrition. You won't be able to lift properly and do proper exercise. Mental health would feed into all of that, right? You can't eat well, you can't sleep well, you can't exercise well, and kind of all goes circular. And yeah, I mean, I think generally, I think it's good to also talk about this metabolic health versus kind of your weight as well, right? Because a lot of people who are metabolically healthy are somewhat overweight, but also they're somewhat short of breath, right? Like I see that all the time, right? Like people coming with diabetes, I get this consult all the time. Diabetic patient comes in short of breath, right? And obviously the family doctor is worried that because they're diabetes, the first thing they worry about is, okay, they're short of breath, they might have blockage in the arteries of the heart, right? So they send them to me to work them up. We work them up. We don't really find anything. Cardiovascularly, at least, there's no obvious cardiovascular issues, although for sure, if you do more look, they're going to have atherosclerosis. They're going to have plaque in their arteries. But a lot of these people are short of breath because they're not metabolically healthy, right? Right. It's because they're not actually able. They're unconditioned. So when we talk about unconditioned aerobic capacity, exercise capacity, all of these essentially is about your metabolic health. It's about how your body is able to utilize the energy it has, how efficiently is able to utilize that energy. And that's what I tell them most of the time. Almost every diabetic patient I have is, generally speaking, if they're not have a good muscle mass and exercising, they are somewhat short of breath. And it's because they're not metabolically healthy, because they are insulin resistant and they're not utilizing energy effectively.
Right. I mean, to plug muscle mass for a second, because I'm super passionate about that. I even have a select group of people who are endurance athletes who are sort of metabolically unhealthy, actually. Those are really interesting people. They end up getting diagnosed with prediabetes. They maybe, hit menopause or, a little bit older. Not women, not just women, but I do see it a little bit more in women. And they're really fit and they're really lean and they're small. Maybe they're actually a little bit higher body fat, but they look tiny, right? And they've been doing endurance sports for their whole life. And interestingly enough, their cholesterol levels are high and their sugars are a little bit borderline. And they're very, very frustrated because, the typical information would be like lose weight or, start exercising. You're talking to this person who's out there trail running for 3 hours every Sunday, But the reality is they have no muscle mass. And so to me, I think what's becoming clearer and clearer, and I think it's getting a bit more press now too, is that lean muscle is basically like the magic pill of all things. Super protective over all of these things, even if you are fit, cardiovascularly fit, which is probably protective to some degree. Having lean muscle mass is actually maybe, I don't know if it's more important, but equally as important to just being aerobically fit.
100%.
Would you agree?
100% I agree. I think you and I have talked about this multiple times before. I think muscle mass is probably the most important thing when it comes to metabolic health specifically, right? And the way, I'm actually curious how you discuss it with clients, because what I tell them essentially is you should really think about muscle mass as essentially the engine of your body,
Yeah,
right?
absolutely.
Right. And it's basically kind of mopping up. I mean, it's kind of a oversimplification, but essentially is that's kind of what it's doing, right? Like it's kind of mopping up all these blood glucose, mopping up all this crap out of your blood. So it's doing you're going to have a better glycemic control as a result. Your blood sugars are going to be better regulated. You're going to be more insulin sensitive, which is one of the foundations of metabolic health, because your muscles respond to insulin, actually respond to glucose almost independent of the insulin.
Yeah,
right?
exactly.
Yeah.
Yeah. I mean, I always, whether I'm talking to my athletes or just general population trying to, with prediabetes or diabetes or anybody really, I talk about it as being sort of you're driving a car, you're driving a truck, or you're driving a little mini, right? So those storage containers are what store your glucose levels. So the benefit of having larger containers is that, it's not going to get poured into fat and, end up around the belly and as triglycerides, so, and in fact, it makes it, less diet related, less diet dependent. I mean, my job is trying to help people be less frustrated. I think, they're all coming in frustrated. They're frustrated with their predicament. They're frustrated with their weight. They're having a really hard time losing weight. It's hard. Like, it's freaking hard. And it's harder for some people than others, especially if they already have, I think, that metabolic picture, maybe genetics or whatever, not on their side. And so, although I'm a dietitian, I think that I spend more, really I do.
You do.
I think I spend more time talking about the muscle piece, because the reality is that most people, especially women, right, have a really, really small calorie budget. Like, it's just the reality of it. And it's not because I said so. It's because these energy equations are based on their size and their muscle mass and, and their age and all of these things. And so a lot of those things can't be changed. Well, most of those things can't be changed. The one thing that can be changed is the size of your storage containers, right? And how you are manipulating that. So I think that as far as the empowering message that I can give to somebody outside of just, count your calories and stop eating cookies and, whatever else, and which is really, really hard to do, and, eat less and eat less and eat less, especially as you get older, because this is happening no matter what, right? Like, you get a few years older and you get a few years older, and this trajectory is not going well, right?
Yeah,
it's getting worse. So, I say to people, sort of thinking about the billable hours versus the investment that you're making, where you can sort of sit back in your chair, as the CEO, and the money's coming in, it's like investing in real estate or something like that, So my business model is I see these patients and I billable hours, but then what am I going to do, on the back end of things to make sure that when I'm 60, 70, that I don't have to work, 10 hours a day. So that's where I think the strength training comes in, and the muscle mass piece. So I feel like that message has to be really strong, because it actually allows people to eat more. It actually allows people to be less restrictive with their carbs. It allows them to have that bagel. It allows them to be more metabolically flexible, which is easier, in my opinion. And improve their bone health, reduce their risk of falls, all the other, improve their mental health, and, probably to some degree improve their hunger hormone regulation, improve their sleep, most likely, improve their functional ability and mobility, and probably reduce pain. So, so many other benefits, whereas, I'm not saying restricting your food is not necessary and changing your diet isn't necessary. I'm just saying that from a messaging perspective, I like saying increase your storage capacity and make your insulin work better for you, rather than take away this, take away that, take away this, take away that, because there's no end to that, right? If you don't change the other piece, I think.
Yeah, I agree, right? So I think you said a couple of very important words that I just want to double click on. So, we talked about the metabolic flexibility that muscle mass brings. So it's basically this idea that you essentially can eat, instead of having a super restrictive diet, you're able to eat a little bit more diverse and still not necessarily gain a whole lot of fat, not necessarily gain a whole lot of weight, talk about energy budget, which is an important concept to understand, right? So basically the reason you're talking about that is because, and correct me if I'm wrong, is because essentially the more muscle mass you have, your basic metabolic rate is higher to begin with. So as you're even sitting, you're kind of burning calories, right? So the more muscle you have, that kind of basing resting metabolic rate is higher. So you can kind of lose weight a lot easier because you don't necessarily have to restrict your calories nearly as much in order to lose fat, right?
You're right. You can, and maintain better, right? Especially as you get older, right, where muscle mass is decreasing anyways. And this is where I think too, women, right, struggle. Like everybody's seen that meme where their husband goes out for a walk and he loses 10 pounds and, the wife is like doing all this stuff and she gains weight or whatever. But I mean, to some degree it's true, right? And that's why I think even with women, especially, not to say that men are not included in this because it's the same. It's just that with women, they're usually shorter, right? They naturally have less muscle mass to begin with, right? They don't have the same hormones. So women are stuck with a smaller calorie budget. And you're going to say, well, sorry, you're 1,200 calories, that's all you got. You know what I mean? And you're 5 foot female, 5'2", if you're a little taller, well, you get a little few more calories there. And that's the way the cookie crumbles. You can't change anything about it, right? So the changeable factor is because you're not getting taller, you're not becoming a man, you're not getting any younger. So what's the variable that we can change the most? And that's why I guess the messaging is that it's not to say that you strength train and it doesn't matter what your diet is, absolutely not. And of course, if you have prediabetes or you have glucose issues or you have cholesterol in the blood or whatever, there's going to be dietary things. I mean, that's the whole piece of the diet, of course. There's things that we can do to make that better or make that worse. But when it comes to, I think, strictly speaking about cardiometabolic health, body composition, if you were to say, like, Deb, what's the most important thing right now? It would not be food restriction to me. It would be go build some muscle.
Very good. No, I think that's a very good summary. I think it's also good to tell people a little bit about what happens if they don't do that, right? Like, I always try to kind of draw a picture of we talked a little bit about it, right? Like we talked about a little bit about, okay, so if you don't have enough muscle mass, if you are not metabolically healthy, you develop issues with your sleep, with inflammation, with your mental health, with your functionality, basically your functional capacity, what you're able to do on a day-to-day basis without getting short of breath, basically enjoying things you want to do. But then in the extreme form of it. So let's talk about what happens once this turns actually into a disease. So what's the next stage? After somebody's just metabolically unhealthy, what is the kind of the extreme of the disease conditions that would develop if they don't take care of their muscle mass and their diet and their weights and all of that?
Well, I mean, I think you see people really deteriorate in terms of functional ability, as they get older, less able to get around. I find arthritic conditions, although it sounds counterintuitive, but they get worse because they're not being used and the muscles around those, those tissues and joints, actually, they're weaker. So there's more stress on the joints. I know, again, people seem to be afraid to exercise as a result of that, but it actually is beneficial.
Would help them, yeah.
And then, I mean, of course, I don't know if this is what you were getting at, but in terms of, the downfalls of having elevated glucose levels and things like that, I mean, this is where, a little scary, right? Kidney function, eye health, neuropathies. I mean, these are all things that are real issues that, unfortunately, it doesn't even take that long, I think, if glucose levels are not regulated to see some of those things happening, right?
Yeah.
So, I mean, obviously no good. And higher risk of heart attack and stroke. Probably you can speak to that a little bit more. And overall, I think just a feeling of unwell. And I mean, I think that it's in a counseling position, have to be very, sensitive and empathetic to that to some degree, right? Where people are feeling tired and it's hard to get started, right? It's a bit daunting when they're feeling like crap and they're not sleeping well. And their energy levels are all over the place, and, they are having pain and all, you know what I mean? So it's difficult to, maybe their mental health isn't great either. Difficult to get out of that point where you say, listen, you are going to feel better. You have to just get started. And then once you get started, you start to drink the Kool-Aid a little bit. And then, so that's where habit change and behavior change happens. But it can be difficult when you're feeling bad.
Yeah.
I think to get out of that cycle.
Yeah.
Right?
Yeah. 100%. Yeah. So, I mean, you kind of banged all like the nail on the head, right? So poor metabolic health, poor functionality, elevated glucose. And glucose is essentially, I mean, people don't realize glucose is essentially a toxin in a lot of ways. I mean, it is a unit of energy in your body, but excess glucose, it damages all your organs, right? From your kidneys. Yeah. Well,
I'm doing my best.
You're working on it. But yeah, it's like toxin to everything, right? From your kidneys to your nerves to your cardiovascular system. It increases inflammation overall. So that's how it essentially causes all the cardiovascular issues, forming plaque in your arteries, increasing your risk of heart attack and stroke. Same thing in your eyes. It's toxin to the eyes, to the retina. People don't realize, like people develop all these issues in the vasculature of their eyes because excess glucose is a toxin. I mean, that's kind of a very simple way of thinking about it. And it causes all these downstream effects, including all the inflammation and then the sleep issues. And then fluctuation of the glucose makes it even more toxic, right? Because that's when it affects your energy by these kind of wide fluctuations. And that is diet dependent. That's muscle mass dependent.
Absolutely. And stress, by the way, we shouldn't underrate that, and poor sleep, right? And I guess maybe just to clarify so people don't misinterpret what you're saying, it doesn't mean that eating sugar, glucose, or carbohydrates, which are effectively the same thing, is necessarily the problem, right? It doesn't mean that carbs are bad. I mean, just because people will interpret what you just said that way.
Right.
It means that if you're not metabolically healthy and your body isn't using carbs well and you're overeating them, that then there's an issue, right? And of course, in type 1 diabetes, I don't make insulin, so I'm trying to manage that the best that I can. In prediabetes or type 2 diabetes, there's more ability to change those factors by reducing body weight to some degree, getting more active, and manipulating the diet, which doesn't necessarily mean keto, by the way, which we're going to get to help your body use carbs better or put less stress on the organs that are not working as well, even transiently, while you're reducing body weight and becoming more insulin sensitive, to better use glucose and not require the same amount of insulin by not putting as much glucose into the body, I guess.
Yeah, that's perfect. Yeah, that's perfectly put, right? Like carbs and sugars are not bad. Too much carbs and sugars are definitely bad. And that's variable a little bit depending on your muscle mass and how much activity you do.
Exactly.
And you and I see some of those patients, right? That actually our recommendation to them is when you're working out, you need to actually have more carbs, right? You need to have either a snack before or afterwards, because that's actually going to help you fuel your workout and potentially help you build muscle mass more effectively if you're doing a very intense workout session.
Right. And by the way, unfit people or untrained people need more glucose to do the same work.
Right.
Right?
Because they can't utilize their fat.
Yeah, and they're working harder to do the same effort, and their body is using more glucose for the same, right? So the more trained you get, and this is kind of what I was describing before, even though I was a fit person, but I wasn't really a great runner, and I didn't have a great low zone aerobic base to burn fat, but that's changeable. So it's the same thing as you get, as your muscles grow and as your insulin sensitivity increases, and as the mitochondria change, and adapt to what you're doing, and you become more efficient at what you're doing, right? You percentage-wise can use, you don't need to fuel as much glucose, in other words, right? Because you're better at accessing fat for energy.
That's a very good point, Because that's almost counterintuitive. We would think if somebody is overweight and they are just starting to work out, that we're going to cut their carbs a lot more aggressively than somebody who is much more advanced, but it should be actually opposite. They need to eat more carbs if they're just starting to exercise, because they need those carbohydrates a lot more for their workout than somebody who is well-trained.
Exactly.
Right. Perfect. So now you kind of pointed out a little bit, you talked a little bit about weight loss. So now, I think we've convinced people that it's important. Metabolic health is important, and getting muscle mass is important. Having enough, not having too much fat and having enough muscle is important. So now you and I see a lot of these patients in longevity clinic where a typical patient, actually, a lot of the patients that we see that come and ask for help are these patients who are metabolically not healthy. So they already have insulin resistance. We can detect that based on their blood work. We also see that consistently with their body composition. So they have too much visceral fat. They don't have as much muscle mass. And these things are all connected to each other. So how do we approach a patient like that? Like, what would be, if people want to kind of start on that path, what are some of the recommendations that we give that kind of client to try and help them get more metabolically healthy?
Yeah. I mean, I work with clients in a very sort of personalized way. So, I mean, there are some real general things that I think I see a lot of the time, and general recommendations around certain dietary strategies and certain, let's say, dietary protocols, or we won't call them a diet, but protocols like Mediterranean diet and things like that are going to be generally good. You can't go wrong kind of thing, right? But I think that the first step is often awareness building, right? Before people want to change really, they come in really motivated and they want to get going, and, they want to maybe even go too extreme. Sometimes my job is to pull back a little bit and say, listen, like, you need to find out where the issue is, right? That happens a little bit by talking. What's your lifestyle like? Where is the top tier problem for you, right? And that might not be the same for everybody. But most people don't really have a really strong awareness, I think, of their eating behaviors. And what I often see is that what they recall, if they do like okay, what do you eat in a typical day, or, what's a typical week look like for you in terms of like, what are you eating for breakfast, lunch, and dinner? And do you snack and this and that? Will often be very, very different from what I'll see if they're actually, honestly tracking their food for a period of time without changing anything, which is really hard to do because they've already seen me and there's a bias there already. The minute you start tracking, there's a bias, like, oh, I don't want to put that in there, but it does highlight, how all the little things add up, and how maybe what you thought you did isn't really what you're doing, or, portions and things like this, or where calories even come from. So my job isn't, I prefer my job not to be to just hand somebody a diet plan and say, do this. It's to say, do you understand what the challenges are? Do you understand what you're actually doing? Do you understand anything about, calories at all? And when they start putting it down on paper a little bit, they start to make their own insights, right? And that's really valuable, because I think when somebody sees it for themselves, it often has more, holds a little bit more power than me just being like, guess what, right? And if they're doing that in a guided way, I think rather than just, downloading a software and getting really frustrated and putting it in there and not really knowing how to make any sense of that information, they often get less out of it than they would if they would come and do that with me. So sometimes the first stage is just say, listen, track a little bit, and I don't want this to be forever, but we need to figure out a way for you to understand a little bit more about what you're taking in. And then we can start saying what needs to change, because you're seeing the pattern, you're seeing that you're taking in 800 calories after dinner, with chips and beer, or you see that, in the morning, all you're eating is a bagel, and then you're wondering why you're starving and craving sugar all day long. These people think that they have like these sugar addictions that are just, I have no discipline and I am addicted to sugar, but oftentimes it's a symptom of something else, right? So, ideally it's a process, right, where they're game to kind of learn a little bit more, and then we can start making changes rather than saying change everything, or like, okay, you came in here with, cardiometabolic factors, let's go keto, or like, let's just start fasting all of a sudden, which, we could talk about that too. But it's often a little bit simpler than that, to be honest. And it's just, I realized that I consumed 500 calories just with the oils and the, mayo that butter that I was putting on my toast. Like, cool. Okay. That's maybe easy to change, right?
Mm-hmm.
Maybe some of those things are easy to change. Or, I didn't really realize that I was having 10 drinks a week. Maybe they report that they drink, here and there, but they don't. And that's, let's say, a couple hundred calories a drink, right? Outside of all the other negative effects that it has, right? You're usually eating when you're drinking too. So there's, other things. Maybe that's where we start, right? So it can be changing something, or start eating protein takes care of a lot of problems.
Yes.
Right? I mean, we want to talk about protein for sure.
Yes.
Right? Outside of strength training, like I could just put that on repeat, right?
Yeah. Yeah, exactly. So let's talk about that, right? Because I think you and I, basically almost every single patient see, that's what we recommend to them, because almost none of them are eating enough protein, right?
Yeah. I mean, I think some people, or they're not distributing the protein properly or something like that, right?
So why is that important? Let's talk about that.
Yeah. I mean, what I typically see is people, they'll come in saying, I'm hungry all the time, or I tried these diets and they don't last or they don't work, or I'm not feeling like I have low energy throughout the day. I just craving carbs all the time, sugars, that 4:00 crash where they're, going to the whatever vending machine and, getting a chocolate bar or something like that. So it's often a really poor breakfast or none at all.
Right.
I mean, let's leave fasting on it. We'll shelf that for a while and talk about the other benefits of that and how it can work for some people. But I would say I wouldn't try that first necessarily if somebody's coming in. We're just trying to do basic changes to see. A really high protein breakfast is going to help keep you satiated. And oftentimes when people are eating enough protein, like they don't have to overdo it and guzzle protein shakes all day, but eating a good portion of protein at breakfast, lunch, and dinner, maybe at a snack, around their workout. You know what they come and they say to me? They say, oh, I don't know. I just wasn't snacking anymore. I'll be like, oh, that's interesting. They'll just be like, yeah, that's weird. I just haven't really, I don't know, didn't have those sugar cravings anymore. Right. So which is when something is no longer hard to do, because it's not like they're like, can't have the sugar, can't have the sugar, can't have the sugar. It's just their brain is saying, oh, I don't need that. So they're not thinking about it. So they don't really feel restricted anymore, because protein has this really high satiating effect of all the macros. And so if it's not there, people tend to feel more hungry all the time, right? So they have that propensity to be like, I'm hungry, I'm hungry, hungry. And if you're trying to also reduce calories, well, that just makes it worse. So if we're trying to do a combination of, glucose control, feeling stable through the day, especially for people who have more glucose issues, right? Glucose and insulin issues where things are going to be less stable. And we want people to maintain or be able to build muscle mass in a deficit if we're trying to reduce caloric intake. Protein has to be the star. Yeah. So of all the diets there are out there, I mean, I would be partial to a higher protein diet.
Yeah.
Unless you have pre-existing kidney disease or whatever, but we don't really see most people, the evidence does not show that there's high risk for a higher protein diet. And as far as, do you want me to talk about guidelines for that, or
I don't think numbers? We need to talk about guidelines. Need to do that, yeah.
So, yeah, I mean, I think satiety is key. And there's also other cool things about protein where it actually increases.
Actually, maybe do talk about the numbers. I think you want to talk about the numbers? How much protein, right? Per day?
Yeah, well, I mean, I think people get confused about that because we talk about a gram per pound of body weight. And if somebody is really, if they're obese or they're overweight, that number is necessarily going to be what we need. We might be looking closer to supporting their lean mass at least, or if they have an ideal body weight, we could kind of go down to something like that, or, maybe even a bit less than that, right? So I'm a little bit of a fan of getting most of it through food. And if people feel the therapeutic effects of a higher protein diet when they're going from 60 grams to even 100 or 115, if they're satiated there and they're feeling good there, I don't feel the need to say, well, you need to get up to 150
Right.
because that's a gram per pound. I mean, I think we're looking for that higher level of protein where it's, replacing carbs because in most cases, they're not active enough to be needing that amount of carbs at that time. And they likely have some insulin resistance or, glucose issues where if they're replacing a little bit of that lean protein is important,
Right.
not protein that's, riddled with fat, that they're going to be full, replacing some of the carbohydrates with a little bit more of that lean protein. And the lean protein has more benefit to them because it has a higher thermic effect of food, which means you burn a little bit more calories eating it, less likely to be stored as fat than carbs and fats as a proportion. It's not like it doesn't exist, but it's just less likely to be converted into fat. Doesn't affect glucose levels that much, helps the muscles, and keeps you the most full. So all in all, right? Like check,
Yeah.
right? Probably the best thing,
Yeah. Yeah.
right?
Absolutely. Yeah. So, yeah, I mean, that's bang on, right? Like what you talked about is for every patient almost that we see, they're going to get something out of it. If they're under muscled, protein is going to help them. If they are in that kind of pre-diabetic to diabetic range, protein is going to help them because it stabilizes their glucose. If the issue is losing weight, it's going to help them because of the satiety effect of it.
Exactly.
So
And
almost
muscle protection, right?
and
While you're
muscle
doing
protection
that. Yeah.
while you're losing weight.
While you're
That's
losing
right.
weight.
Well, that's right. So almost in every kind of sector that we look at of patients who want to optimize their body composition and metabolic health, probably looking at their protein intake is a very good place to start.
Yeah.
So you kind of mentioned this. So let's quickly talk about that and then we'll kind of move on to the diets.
Yeah.
But what is the optimal type of protein? So you kind of mentioned this, that you want to get high quality protein because, I mean, we hear this from different people. So what should I be eating for my protein supplementation? What's the ideal source of protein?
Yeah. I mean, I think that if we're looking at melding that with recommendations for, heart health, plant protein is becoming something that we're talking about more. So that could be something like tofu, tempeh, legumes to some degree, not quite as bioavailable, and they do have carbs, but they're also high in fiber, so it kind of offsets that a little bit. And, I guess tofu being the main one there because it's isolated protein. When we talk about isolated or lean protein, we talk about something that doesn't have macronutrients or calories coming from carbs or fats, right? So it's just the protein, right? Which means in those cases, just like with something like lean chicken breast or lean turkey breast or egg whites and, lower fat dairy products like cottage cheese or Greek yogurt and to some degree a protein powder, but, in moderation, those are going to be lean sources where you can kind of eat more for less, right? So because they don't carry fat calories and they don't carry carb calories, you can eat a fair bit without getting a lot of calories. You're going to easily meet your protein needs, very, very bioavailable and very satiating. Mm-hmm. So, I mean, that's kind of the short list, I guess, of the things that are not like lots of foods have protein in them, but, and contribute to your total daily protein requirements. Absolutely. Your grains, your whole grains, your nuts and seeds, quinoa but I wouldn't call those protein sources.
Yeah.
Right. And I think that's where education comes in a little bit. You start to tell someone to, start eating more protein and they start eating a lot of nuts and they start eating a lot of cheese to meet their protein needs, they end up getting fatter. So this is no good.
Yeah.
And it is so it's just making sure that they understand that those foods fit and they contribute and they're good to help regulate blood sugar control when you're eating carbs in combinations with, those fats and stuff like that. But lean proteins are the things that you want to bank, right? You want to identify those as those grocery store staples that are going to be in your fridge and that those should sort of be, on your plate at meal times. Canned fish is a great one. Canned tuna, those types of things, right? And those all fit within the Mediterranean diet. As the Mediterranean diet doesn't exclusively mean plant-based. It means more plant matter in general and more plant protein as a proportion, but also bringing in, if you want, some of those lean animal proteins.
And maybe
would
whole
you agree?
foods, right? Yeah, 100%. And also whole foods, right? I think a lot of the focus of Mediterranean diet, because I see this sometimes, like people go and pick up ultra processed food that says Mediterranean on it. And just because it says Mediterranean, they think it's a good thing.
Right.
So I think that's also the other focus to kind of remind people is a big part of Mediterranean diet and why it's been effective in the initial research studies is because this is essentially whole foods. This is unprocessed food that has a huge role in your metabolic health, is the fact that you're eating whole foods that usually has fiber, high quality, doesn't have all the preservatives and the crap that can affect your gut health.
Yeah, gut health.
Yeah, increases energy density, right? The UPF, you eat a lot more of it because it's a lot of
hyperpalatability. Absolutely.
Yeah. So,
I mean, I think, with so much messaging out there, you can get super complex and advanced with nutrition messaging and stuff, and you can go, deep diving. But at the end of the day, honestly, if everybody filled their plate with more vegetables and everybody filled their plate with lean protein, like we'd probably be doing okay. And if that's the only thing that you take out of a session with me is to be like, oh, eat more vegetables and, identify those lean proteins, like chances are you're going to lose some weight. You're going to feel better. Your cardiometabolic factors are going to improve because by nature of that, you're probably eating less sugar. You're probably eating less in general because you're just so freaking full. I mean, that's what people say, right? They're like, I couldn't even eat that much, right? Because they realize that when they fill their plate with those things, they're just not that hungry anymore. So, simple messaging like, okay, add more vegetables to your plate, prepare those chicken breasts on the weekend so that you have those to add to your salads or whatever. I mean, then they're not hungry. It doesn't feel so hard.
All right. It's already 4:40.
Oh my God, time goes by.
So let's quickly talk about the diets. I want you to talk about them in 1 or 2 minute intervals. Let's talk about, so we talked about weight loss. I think it's pretty good. The only thing I'm going to add about weight loss, because you talked about it very briefly, is this whole idea of intermittent fasting. So let's talk about that quickly. And then the difference between essentially these 3 schools of thought for weight loss, right? Like diet restriction versus calorie restriction versus time restriction. How should we combine them? How should we think about them in each circumstance? Let's quickly do an exchange on that.
Okay. I am neutral on fasting. I think it works amazing for some people, and I think it works really shitty for some people. I would say women, and this is an observation that is partially, supported, but whatever. Don't want to deep dive too much. I do think that long fasting doesn't work that well for some people, and it ends up biting them in the ass.
And why is that?
Muscle protein breakdown, and then they end up getting hungry at night, and then they end up snacking, and not great. And especially if they're fasting through all their workouts and they're trying to increase muscle mass. Like I think that there are nuances to that where, maybe even cyclical fasting, right?
Mm-hmm.
You do fasted cardio sometimes, but not when you're doing your heavy lifting or your hard training. Or quite frankly, you try it out and you feel like garbage, don't do it. You know what I mean? You got to maybe see how that works for you. I think that people who do have more glucose regulation issues or insulin resistance, sometimes maybe even at the beginning, that a little bit of longer fasting into the morning can be useful to just help their body burn a little bit more fat and get into ketosis for a bit longer. But there's probably a point at which it's not benefiting you. I mean, I don't know if you agree with that, but
I think muscle mass is a big point. It's very hard if you're doing hardcore intermittent fasting. If you're doing 18-6, it's going to be hard to build muscle mass. During those 6 hours, we talked about the importance of protein intake. It's going to be very hard.
Yes, and this is it. This is it, right? Protein. And the shorter your eating window, the harder it is to fit in that that protein. And I would say even observationally, I think when people are eating really large meals, I know total calorie intake should be the top tier thing, but I don't think your body can deal with all of that. No. Not just even just the protein, just that amount of total caloric volume condensed into 1 or 2 meals. Not
healthy.
I don't think it's great. I don't think it's
there's evidence for that for protein absorption actually.
A little bit to some degree. A little bit, that's been a bit debunked, but the distribution is going to be more optimal, right? And I think even when it comes to carbs and fats and calories, again, if you think of yourself like a car, if you stick that thing in the car and just stick it in there, it's going to overflow. So I do think that I do think in general, people are doing better with a high protein breakfast, particularly females and particularly active people. But I'm not against it. And there is some good evidence for it. And there is some decent evidence for fasted cardio as well, as far as accessing fat and a little bit more on fat weight loss. And I do have some people who say that when they don't eat breakfast, their hunger is more managed. Okay, and if that's true for you, where it kind of blunts your, like they don't eat breakfast, they don't get that like revved up feeling, then okay. I mean, and if that helps you stay in a calorie deficit easier, where you're not having to like micromanage your calories as much, then I think it could work. So it could be trial and error.
So tell me your thoughts about ketogenic diet. I'm going to ask you fast questions that you're going to answer for me.
Keto. Hard, not super sustainable, hard to do only with healthy fats.
And what does true keto mean? Let's define that.
True keto usually means less than 50 grams of carbs a day.
Okay.
For most people, that can range, but in general, and we're talking all carbs. So I mean, at that point, you are looking at like even certain fruits and vegetables for sure.
Right.
And I think
it's not the greatest diet for fiber, for example.
Not the greatest diet for fiber. Yeah. And I mean, in reality, most people are going to have a hard time doing keto really, really well, which would mean, not exacerbating the cholesterol levels and things like that, right? By, okay, great, now I can eat all the bacon I want, because that's fat and that's easy and it's allowed, where they're only really eating fats coming from nuts, seeds, avocado, olive oil. Like, I mean, it's, fish, whatever, salmon or whatever. Like it's challenging. And to be honest, most people that I see are living as a family unit. They're not, all, 22-year-old guys like living on their own, where they don't have to worry about anybody else but themselves. So what, we have to practically speaking, understand what that's going to mean for somebody and, how that's going to affect their lifestyle. Again, I'm not really against it. And I think that some people with glucose issues and insulin resistance do well with it because it is satiating and it does blunt hunger. And when you take carbs out of the equation, you can regulate glucose levels. And if that helps them get to a certain weight where maybe they can then bring it back, in a slow, progressive way. But when we talk about metabolic flexibility, and I know I'm not giving a short answer here, metabolic flexibility is less if you go keto, right? So people are often surprised that when they bring back carbs, they get fat. Well, that's because you just told your body to use fat really well and did not use carbs really well. So you're not necessarily doing yourself any favors.
No. So metabolically, 100%. Metabolically not making you active, making you any better. And the challenge with it is that not everybody loses weight on it because of how you practice it, right? So fat, as you said, is very
calorie dense,
very
right?
calorie dense.
Yeah.
So if you're eating a super high fat diet,
you actually have to eat less.
Yes, you have to eat less. So the only way you're going to lose weight on a ketogenic diet is if you're instituting some form of calorie restriction. The idea is that it creates satiety, and that's how you end up eating less. But I mean, I see people gaining weight all the time on ketogenic.
All the time.
Yeah.
And they don't recognize fat's also the lowest on the thermic effect of food. So you actually probably have to eat less calories than you would otherwise, right? If you're full, I mean, that's great. But I mean, chances are you're really avoiding bagels and muffins and, grabbing that Tim Hortons donut. Like, is it really because you're in ketosis? I think arguably no.
Right.
And
the other thing that I want to talk about that. Actually, let's kind of go into the next one because we don't have that much time is for cardiovascular health, right? Because I mean, this is what you and I do together is a lot of these patients have cardiovascular issues. What are some of the general recommendations that you would give those people, being specific with regards to your recommendations?
So first off, it would be to identify saturated fats and where they come from. I mean, I think...
Why is that important?
So saturated fats are the fats that we see as being most correlated with elevated LDL levels. And those are mainly coming from animal fat. So I think that is where plant-based diets we're seeing some traction there as far as,
And why is LDL is a problem?
Well, why don't you explain that? You're probably a better job than I can on that.
So trans fats equal LDL, right? Because basically, so cholesterol is cholesterol, and that's one of the things I hear from my patients all the time is, there's good cholesterol and bad cholesterol. There is no good cholesterol and bad cholesterol. What we're talking about here is cholesterol particles, right? So they are LDL particles and HDL particles that are circulating and moving cholesterol around your body in your blood. Cholesterol is an important physiological part of the processes of your body. So you do need cholesterol. So cholesterol is not bad.
Right.
That idea that cholesterol is bad is basically a wrong idea altogether. The problem is what type of quality of fat are you taking in and how that's affecting your circulating levels of LDL particles. And the reason LDL particles are bad is because those are the ones that are sticky. Those are the ones that sticks to the wall of your artery, cause inflammation in the wall of the artery. Your immune system responds to those LDL particles and form plaques in your arteries that then cause heart attack and stroke. And really what saturated fats do more than anything is it affects the LDL receptors at the level of your liver. So it's not like that saturated fat you're taking is directly going into your blood. I mean, that's a kind of oversimplification of it, but that's not how it is. Your liver is actually what processes the cholesterol and moves the cholesterol into these different particles. And what happens when you're taking a lot of saturated fat is that saturated fat gets stored in your liver. So it tells your liver that, oh, there's too much cholesterol around, too much. And what that does is that then it down-regulates the LDL receptors on your hepatocytes, which is your liver cells. And by down-regulating those receptors, then your liver is not grabbing those LDL particles out of your blood anymore. And that's what causes the LDL levels to go up. So the reason that, a diet like ketogenic diet and overall red meat, saturated fats are bad for you is because it makes your liver think there's too much cholesterol around, and therefore it doesn't grab all the LDL particles out of your blood, which leads to elevated LDL particles, which leads to atherosclerosis, which is plaque formation in the
arteries. Right. And the HDL, which we call the good cholesterol in the blood, helps to pull it out.
Right. Exactly. And then what elevates HDL in general when it comes to nutrition and lifestyle?
Yeah. So good fats, right, which we call, those polyunsaturated fats. Olive oil, avocados, nuts and seeds. And so that's where the Mediterranean diet really shines, right? Because it's focusing on those things and not exclusively saying no animal products, but just when you're eating those animal products, picking the ones that are low in saturated fat, which is leaner proteins, right? Which are going to be less calorie dense. So all around, like it all sort of fits in a nice little puzzle.
Can you quickly talk about how refined sugars play a role in this whole cardiovascular health, cholesterol kind of situation?
I think we see triglycerides responding specifically to excess sugar. That's, and again, where it's deposited in terms of the type of fat distribution in that around the middle area. People who tend to have the cardiometabolic syndrome, where the sugar levels and the insulin resistance are up, often also have high triglycerides. And that can be not only just over fats, over intake of calories and fat, but over intake of sugars and alcohol as well. And I think that in general, we're seeing, refined sugars also being a factor in just general inflammation. So cardiometabolic health, I think, is an inflammatory process too.
Okay.
Right?
Yeah. That makes sense.
Agree with that?
Totally. Yeah. So I think it's totally about your triglyceride and it's about your metabolic health. So when you're taking too much refined sugar, you become insulin resistant. That kind of leads to all the downstream effects that we talked about a little bit, because that would kind of essentially throw your lipid profile out of whack when you're insulin resistant. And as a part of that, then your HDL particles and we don't really understand this actually very well of what happens, but definitely your HDL cholesterol goes down. So we conclude, although we're not certain, that affects the HDL particle functionality, which is clearing the cholesterol out of the wall of the arteries. So it seems like your HDL particles are less functional. Looks like your LDL particles would go up, and we've had an exchange about that. So I think it adversely affects your lipid profile once you become insulin resistant, and your refined sugars would definitely affect that. And as you said, as a good marker of that, we usually see triglycerides going up. usually a sign that you're developing metabolic syndrome and insulin resistance, which then kind of affects this functionality and balance of HDL and LDL.
Right. And I mean, at a dietary level, if you're eating refined sugars, you're usually going to crave more sugars.
Right.
Right. I mean,
Right.
it makes you hungry. It makes your glucose levels fluctuating more, even if you don't have insulin resistance per se. And then you're usually overeating as a result of that because they're not satiating.
100%. Quickly, as the last point, I want you to quickly talk about DASH diet.
So DASH diet is a diet that's more correlated when we think about hypertension and high blood pressure. You know, if you're looking through the DASH diet, though, it's really not that different from other protocols like the Mediterranean diet and even the plate method, to be honest. You know, I'm not a huge proponent of Canada's Food Guide, whatever. I don't pull it out in my office on a regular basis. But the plate model that they've put out more recently in the last few years actually does do a decent job of just showing people, like, generally speaking, what their plate, you know, could and should look like. Maybe I would like increase that like protein component a little bit more for most people than what it suggests.
What does it look like in the Canadian Food Guide?
So half the plate, fruits and vegetables. And if I'm talking to somebody with diabetes or insulin resistance, I might say like more vegetables over fruits. And, you know, it's a quarter plate of those, you know, whole grains or starchy carbohydrates, and the other quarter of the plate coming from lean proteins. And they've sort of included, you know, plant proteins in that category. And so I might edge towards like a little bit more on the protein, a little less on the grains and the carbs, depending on the individual.
So very low fat diet, eh?
Fats kind of, you know, come into play. They're
Right.
not, you know, whether within some of the proteins that you're choosing, within the, you know, some of the plant-based things that you're eating. They don't specifically have like an item for it, but it would be sort of on the side where you're, you know, adding, you know, there's room for adding cooking fats and things like that. And if from a cardiometabolic standpoint, olive oil, you know, that polyunsaturated fat is the best. I think this whole seed oil thing is like driving me crazy because it's just not evidence-based at all. But stick with your plant-based oils and you're going to be good, right? Just avoiding butter and things like that as much as possible. If we're specifically looking at cholesterol levels, lowering your LDL cholesterol.
So what is exactly then in DASH? Like, what are the main principles?
So the principles would be, I mean, whole grains. They actually have inclusive of more dairy products in there because those are higher in calcium and magnesium and potassium, which seem to help kind of regulate blood pressure. It's all sort of those ion channels with those minerals. So they are encouraging dairy products. And so if you're choosing those, you would be also ideally choosing low fat, you know, your Greek yogurts that are high in protein and low in fat for those things. And lots of leafy greens and fiber and things like that. Or otherwise, really not a whole lot of other specific things, right, that are super intentional, but all of those general principles that we would be talking about for a balanced diet, right?
Yeah, also Mediterranean diet, right? Like,
yeah,
very
same
similar.
things, very similar.
Yeah.
You know, if you have high blood pressure, you might be looking more specifically at sodium, which is something that I think we were obsessed with it a few years ago, and then we kind of got off that train. And if you have high blood pressure, you have to be concerned about it. If you don't make reasonable choices, if you're not eating out, if you're eating whole foods, if you're not buying a lot of processed foods, chances are you're, you know, doing okay without micromanaging your sodium. There's going to be a few things that, like deli meats and things like that. But again, that's processed stuff, right? So where you're going to find, you know, your whole daily sodium intake right there. Yeah. I don't know if you focus on sodium a ton in your practice. But
So, I mean, for my heart failure patients, I do, and definitely for my hypertension patients,
sure.
I do. So those are kind of the two groups that I specifically talk to them about salt, not with anybody else really. But I mean, heart failure is huge.
Yeah.
I mean, our audience don't probably understand what congestive heart failure means, but essentially it's these people who retain water. That's kind of is the easiest way to kind of talk about it.
We all know what happens when we eat a high sodium diet, right? We look puffy the next day. So.
Exactly. So those patients are the ones that we really have to talk to them about, because even one big load of salt, if they go eat out, they go to a restaurant, it can put them into heart failure and end up in the emergency room. So for them, it's extremely important to be aware of their low salt diet.
Right. I mean, and for education, right? I mean, just learning how to read a food label, right?
Yeah.
Just navigating a food label is really, really good first thing to be learning.
100%. So quickly now, we're way over time, is take-home messages. So give us some key takeaways. If people want to remember 2 or 3 things out of this conversation, what should they remember?
Strength train 2 or 3 times a week, progressive overload and lift heavy.
We should be actually going to talk about it all, but thanks for that key takeaway.
Next time. Eat protein, 30 grams at least at every meal and around your exercise. And fill your plate with a variety, I think is cool because this whole microbiome thing is like, it's amazing and it's going to be the next thing. A variety of colorful fruits and vegetables, the more the merrier. Fiber is also a winning point. And I think all of those things together will allow you to reduce your caloric intake, feel satiated, have better energy, reduce your inflammation, pull cholesterol out of the blood if that's something you need to be doing, and allow you to increase your muscle mass so that you can be a powerhouse.
I love it. Yeah, I agree with all of those. The only thing I would add is kind of stay away from ultra processed food, right? So the less processed, more whole foods you eat that has a good variety, good amount of fiber and protein, you're probably doing really, really well. And if you want to lose weight, really kind of watch how much calories you're taking in. You have to have variety with good amount of protein, but really kind of calorie restriction is essentially how it's just physics, right?
Yeah, it's
Calories
just
in,
physics.
calories
But
out.
I think that the take home and the practical side of things is, especially if somebody doesn't want to be tracking their food and counting calories, right? If you have protein on the plate, lean protein, and you have vegetables on the plate, you probably don't have to be micromanaging as much because you're going to be full. You're not eating hyperpalatable foods that are hard to control the portion. You're going to be snacking less because you're going to be less hungry and your blood sugars are going to be less crazy. You're going to have more energy to exercise, right? And I think older females, I find they need a little bit more protein to feel good. That's something I've observed. So it's sort of, again, just keep, these are simple things that we've been saying for a long time. People really want to make it complicated. But I had a client the other day who just was like, I added protein to my diet. This was life-changing. And she lost 15 pounds in a relatively short period of time because she just stopped snacking. She was just like, I was full. I wasn't hungry. I wasn't craving things anymore. And then I was sleeping better and had more energy. So I was working harder at CrossFit. It was just crazy. It was just that simple change 100%. That changed around everything. And then I didn't have to tell her to eat less because she just was, right? 100%. That's great when that happens, right?
100%. No, that's great.
Yeah.
I think that's a very good summary. Thank you.
Yeah, thanks.
This was awesome.
Fun. We could talk for hours.
I know. We can talk for hours. We went over 15 minutes and we still have tons to talk about. But next time.
Next time.